Welcome back to the Humble Healer podcast. And this is Dr. Quang Lei. I'm a family physician, and we talk about a variety of health and wellness topics. And always, my um, reason for starting this podcast is to motivate and empower my audience and patients and the community to invest in themselves in order to attain or improve longevity, health, happiness, and resilience. And in this topic, we'll be talking about quitting smoking. And this is an important topic since it has caused many problems in the health of many Americans as well as the rest of the world. And I do see and treat patients on a daily basis, the complication that smoking can cause. And I will not go on and talk about those complications, but we just mentioned briefly about the danger of smoking and focus more on tips on how to quit smoking. So 42 million smoking Americans smoke every day, and more than 500,000 Americans die every year from smoking. And this is the same as three um, 747 airplanes full of people crashing every single day and killing everyone on board. Imagine that. Any person at the age of 50 who smokes has a 50% chance of dying from complications from smoking. Most people need to quit 7 times before they stay quit. I love Mark Twain, and what he said about smoking was that quit smoking is easy. I've done it 1,000 times. Most people need to quit 7 times because they are not adequately prepared for it and just quit cold turkey. And the rate of success is only 3% or less if you decide to just quit smoking. So make sure you are prepared and have a plan, and we'll talk more about that. When the sales age of cigarette is increased from 18 to 21, the percent of teens smoking in high school dropped by 50%. I think it may also have something with the switch from cigarette to marijuana among the youth, as well as vaping. So that's something that maybe we can do more studies on. Smoking is heavily associated with many of the physical and mental health problems we see every day in the urgent care setting: back pain, alcohol abuse, opioid abuse, suicidality. And what tobacco and nicotine do is it activates the sympathetic nervous system. So it can increase blood pressure, heart rate, cardiac output, and doing this every day will give you bad outcome in your cardiovascular health. And in pregnancy, it can cause preterm labor, fetal growth restriction, low birth weight, sudden infant death syndrome, and asthma. And also those family members also can be affected by secondhand smoke, and kids can get attention deficit hyperactivity disorder or on a developing brain. Cessation of smoking can have benefits of decreased risk of cardiovascular death and improved pulmonary function. They have to deal with nicotine withdrawals such as craving, irritability, frustration, restlessness, anxiety, and depression. Studies have found link between nicotine and mental illness. 80% of schizophrenics smoke and 50% of bipolar disorder patients smoke. Despite nicotine and dopamine that come with smoking contribute to problems of attention, mood, and thought processes, and these are made worse by nicotine use. Also, among heavy smokers, smoking cessation was associated with significantly lower risk of cardiovascular disease within 5 years relative to current smokers. However, after 5 years, the risk remained significantly elevated compared to the never smokers. Let's talk about the tips on smoking cessation. Learn a simple mindset shift with 2 immediate actions that you can take and 1 to help you stay on track. On the current lung cancer screening guidelines, current or former smokers age 50 to 80 with a 20-pack year smoking history who currently smoke or quit within the past 15 years are eligible for screening. Please check with your primary care provider about getting this screening done. And this has been proven to save a lot of lives since it came out several years ago. And age 50 to 80 with 20-pack year smoking, which means that when you smoke 1 pack per day, for a year is called 1 pack a year. So the main point of the main tips are opening hook, 10 to 15 seconds. The 5 minutes can change. A quick attempt, one small action can build momentum. And for the mindset shift, don't think of it as quitting forever, as trying for the next 24 hours or one smoke-free moment at a time. This can reduce the feeling of being overwhelmed with quitting forever versus, and also can increase success. Stay smoke-free one moment at a time, one day at a time. Easy, immediate actions include removing easy triggers, such as cigarettes, lighters, ashtray out of sight. Clean one area, the car or jacket, to break any key links. Action number 2, use a quick replacement strategy. Deep breathing, and you can use a different strategy on deep breathing. 7-4-8, breathe in 7, count to 7, hold your breath for 4, exhale for 8. Intense cravings of nicotine has been found to last only a few minutes. So if you can do this, you don't need to do it for a long time. Whatever replacement strategy that you want to use, you don't have to do it for a long time. Chewing gum, or taking a short walk, or doing a jogging in place, or doing 100 jumping jacks, it will snap you out of that. I also have been told by patients that using or snapping an elastic band on your wrist, which is very painful, which I have tried, can snap you out of that cravings. Also, the cravings is the pleasure sensation that you feel if you think about smoking. And once you snap yourself out of it using these above strategies, you can disrupt the link between thinking about smoking and the pleasure that you have in your mind that you think that you will get. Also, one other strategy to help replace the oral fixation is cutting a straw in half and just suck on the straw like a cigarette. And I realized too that a lot of time when smokers smoke, they do a quick inhale or inhalation, and in a way that's like deep breathing. Unfortunately, in that case, you breathe in a lot of toxins and carcinogens. But when you do the same thing with an empty straw, it can help you achieve the same effect without any harm. Also practical to set a single specific micro goal and reminder. For example, just say, I will be smoking free for the next 24 hours, and put a phone alarm or calendar reminder and a brief reward plan. Another thing that you can do, as we mentioned in other episodes, is meditate on communicate to your subconscious mind about when you take a deep breath in the morning before you get out of bed, may be smoke free for the next 24 hours. And then also, if you succeed the previous day, I'm grateful for being smoke free for the previous 24 hours. Keep saying that every day, and that will empower you. And that's, in a way, your self-hypnosis to help you quit smoking. Also, for coping tips, plan one supportive message, text a friend, join an online group, or call a quit line when the urge feels strong. So that's another way another strategy to help when the cravings come. Think about quitting and take one immediate action right now and see if it can help you with the quitting. There are many, many resources that you could use. The National Quit Line, 1-800-QUIT NOW, now QUITNOW, CDC smoking cessation page, and popular quit smoking app such as Quit Guide or Smoke Free. Also, if you live in Massachusetts, then you can use mass.gov. They have free smoking cessation counseling, as well as providing free nicotine replacement therapy. Patient of mine used that service and was able to get the nicotine replacement product within a week. So what's the success of cessation? More than 70% of smokers want to quit. Only 40% of smokers try to quit, and less than 3% are successful if not supported or help, or just basically quit cold turkey. For the nicotine replacement therapy, if you smoke less than half a pack, then you use 7 milligram patch. If you smoke half a pack, then 14 milligram, and 1 pack a day is the same as 21 milligram patch. And you can also add on to the nicotine replacement with the gum or the lozenges. A lot of people complain about the gum tasting disgusting. So I think the lozenges or candies may be more palatable for quitters. Vaping also is important to know about, and it's sometimes difficult to compare one brand to another in terms of the concentration of nicotine. Popular brand is Juul, Juul. Pod contain nicotine equivalent of about 1 pack of cigarettes. 1 ml of vape juice equals 100 puffs and equals 1 cigarette. And you can use the same nicotine reduction technique as decrease the number of puffs and try to taper down on the nicotine product. New studies have supported the use of vaping as a way to quit smoking for chronic smokers. So please, if you know anyone who smoke or you yourself are smokers, check out this podcast. I try to make it brief to make it easy to follow and recommend for your patients or your friends and family, and leave me a tip in terms of what you have done successfully in the past to quit smoking. And I appreciate your time tuning into this podcast. Please subscribe to the channel if you haven't, and hit the like button and turn on the bell notification. Thank you and have an excellent day.